Welcome to MCR Medical's comprehensive guide to using the PRESTAN lung bags. Let's get started. Here at MCR Medical, we have 8 different types of lung bags for all the different Manikin types we carry. This can be confusing if you are unsure of what kind of lung bag you need. This guide goes over which lung bags go with each Manikin and how to install them. We have 4 types of adult lung bags available encompassing the full PRESTAN line of adult Manikins. Our most commonly utilized lung bag is the PPALB50, which stands for PRESTAN Product Adult Lung Bag 50-Pack. These are meant to be used in the PRESTAN Professional Adult Male and Female Manikin with either the standard head or the jaw thrust head installed. The PPVALB50 stands for PRESTAN Product Ventilation Adult Lung Bags. These are meant for the Series 2000 adult male and adult female Manikins. The PPULB50 stands for PRESTAN Product Ultralight Lung Bags. These are meant for use in the adult ultralight Manikin. Our last lung bag is the PPAPLB, standing for PRESTAN Product Adult Pro Plus Lung Bag. These come in a 50-pack and are compatible with the Pro Plus head. We carry 2 lung bags for the child Manikin, the PRESTAN Product Child Lung Bag and the PRESTAN Product Ventilation Child Lung Bag. The standard lung bag is meant for use with the Professional Series Child Manikin, while the ventilation lung bags are meant for the Series 2000 Child Manikin. Similar to the child Manikins, we carry 2 types of lung bags for our infant Manikins. The PRESTAN Product Infant Lung Bags are meant to be used with the PRESTAN Professional Manikins and the Infant Ultralight Manikins. The Ventilation Infant Lung Bags are made for the Series 2000 Infant Manikin. Almost all of our lung bags are installed in the same way with a few key differences. Let's look at how to properly install a lung bag. Take out a lung bag and lay it down flat on a table. You will need to fold each side of the lung bag twice towards the center along the dotted lines. Once folded, it should look like a flat tube that can be inserted through the Manikin's mouth. Pick up the lung bag, making sure it does not come unfolded. I usually hold the lung bag in between 2 fingers as shown in the video. Lift the chest from the tabs at the shoulders and insert the lung bag through the mouth of the Manikin. You will want to make sure to tilt the chin up as you insert the lung bag. If you do not, the T-shaped airway will prevent the lung bag from going through the mouth. Once through, secure the lung bag to the Manikin. Unfold the face shield portion and hook the lung bag on the pins located on either side of the Manikin's head. This will make sure the lung bag does not move when administering breaths. Once secure, unfold the lung bag in the center of the chest, making sure that the circle printed on the lung bag lines up with the chest plate where you'll be doing compressions. Close the chest, and the Manikin is now ready for use. The Series 2000 ventilation lung bags are installed in exactly the same way as our standard lung bag. The only difference is you will need to connect the ventilation sensor to the ventilation lung bag. This sensor just pushes into place as seen in the video. Infant Manikin lung bags are installed in the exact same way as the previous lung bags, but at a smaller scale. You will fold the sides twice inwards along the dotted lines and insert the lung bag through the mouth. You'll make sure to lift the chin of the Manikin so that the lung bag easily goes through. Unfold the lung bag and make sure to line up the circle on the bag with the chest plate. Unfold the face shield portion and secure it to the ear hooks on either side of the Manikin. Once secure, close the chest area, and your Manikin is now ready to be used. The only lung bag that is installed significantly differently are the Pro Plus head lung bags. These lung bags are meant to be easily installed, and the head is designed to be compatible with NPA devices. To install these lung bags, you will first need to remove the head from the Manikin and open it up. Press the 2 buttons on either side of the head to take it apart, and then the bag simply pushes into place on that white plastic mouthpiece. When putting the head back together, make sure the lung bag is flat at the neck, and the head should just click back into place. You will then open the chest and place the head back on the mannequin, making sure the long bag is lined up with the chest plate. Close the chest and your mannequin is now ready to be used. Though there are differences between the long bags, there are some important points that are applicable to all of them. Firstly, if you're using only long bags and doing mouth-to-mouth training, the long bag should be changed out between each student. If breaths are not being administered by a person, for example, a bag valve mask is used instead, then it is okay to use the long bag multiple times. A single long bag can be used by multiple students during a single class if all the students are given a face shield or mask with a training valve. Filtered training shields and masks will prevent the spread of germs between students while helping to save time and money in the classroom. If you choose to use filtered materials in your class, long bags will still need to be changed after each class period. Previously administered breaths can cause condensation in the lung bags and/or introduce germs to that lung bag environment. This makes used lung bags a breeding ground for bacteria if allowed to sit. At the end of a class, lung bags should be removed and the mannequin cleaned. Here at MCR Medical, we typically use Clorox or Lysol wipes to sanitize our mannequins, but warm soapy water or other non-harsh household cleaners may also be used. Here is a chart that summarizes a lot of the information from this video. If you are having difficulties figuring out which lung bag you need for your mannequin, this chart has all of our different mannequins listed out with the corresponding lung bag product code. If you ever have questions about our products, we can be contacted at the email sales@mcrmedical.com or the phone number 614-782-2100. Thank you for watching, and I hope this video was helpful.